Is the lighting okay? Uh, Hi, good morning. I am in Lima, Peru, and it is such a great privilege to interview and meet with my dear friend, very gracious host, Dr. Carlos Lescano, and he is the dynamic president of the Society of Peruvian Intensivists here in Lima in coordination with the Pan-Iberic Society. And I'd like to, Carlos, it's been a horrible 3 years, almost 3 years of the COVID pandemic. I'd like you to just kind of, share with me some of your experiences with COVID in Peru.
COVID in Peru was terrible. We have a lot of dead people and physicians. For example, we have 570 physicians who died. Initially, we don't have right test to detect COVID-19. We don't have oxygen enough to treat patient when he begins to need oxygenate his blood. The public system of health was terrible before pandemic. That is the reason for many people in Peru die. No? In case of my colleagues, my intensivists and physicians, we work a lot every month to treat patients with COVID-19. For example, I work 300 to 400 hours a month in my hospital to try to cover the high demand of attention. Currently, we save life inside ICU. Our mortality was about 15% in my ICU, but many people die outside ICU because there were no more beds to attend this patient in ICU.
How many, you normally have 50 beds in your ICU?
In my hospital, about 50 beds before pandemics. And we increased them to about 120 beds, but all of the beds for COVID-19. In my country, we have about 400 beds in my country, increased about to 2,000 for COVID-19, but not enough intensivists. Not enough intensivists. We are about 700 intensivists in Peru, and we need about 3,000 intensivists in my country.
To man all the...
I have to multiply our work to cover the high demand, and another physician of critical care specialty have to come to ICUs to help with the work. But the experience treating patients with ARDS and COVID was a little, not enough as intensivists.
No manpower to hold that. What other things you think might have helped in this crisis? Any type of preparation, or maybe help from the government, or what do you think might, if you look back at what you experienced, what do you think might have been helpful for your country to deal with COVID?
Yeah. First, I think it was very important that authorities guarantee that we have the right test to detect an infection like COVID-19. We don't have it. And another important decision is that every first level of attention in our country has oxygen enough.
Oxygen, yeah.
Enough to initiate oxygenation early when people have problems with desaturation. That's very important. And another very important intervention of the authorities is to guarantee the appropriate attention of the patient from the first level and not let the people need to go to the high level hospital for basic attention in case of COVID-19.
Well, there's definitely a significant lesson that we all learn, not only in Peru but all over the world, because of the this pandemic that we were never really expecting. But certainly, I'm sure in the future there will be other challenges. Lastly, what is in every tragedy, you take home a lesson, but there's also a good side that has come out of this pandemic. And what would you say would be, the positive side to this pandemic?
The positive side, I think, is to have learned that teamwork is very, very important. To homogenize the intervention of the patient. No? Every person in that team has to know the philosophy of the attention of the patient in case of this pandemic, COVID-19. No? A problem in another ICUs or another places is that one doctor do something and the next other doctor change. That's terrible. Or the nurse doesn't understand what doctor wants. It's horrible. I think that's very important.
So we all
And here in my country, we need more intensivists.
Yes, calling for intensivists and possibly increasing the training for intensivists
Yes.
and encouraging them, including but teamwork among nurses, therapists, and physicians to save that patient. Well, you have done phenomenal here in Peru, saving people's lives, making a difference for the country, so that you're able to hold this beautiful meeting.
Yeah.
And it's all kudos to you, and it's an honor to to talk to you, and we'll certainly share this message to help people around the world take home some strong messages.
Yeah.
But I thank you personally.
No, thank
Dr.
you,
Lescano. Thank you.
for this interview. Thank you, all of you.